Osteoporosis and diabetes mellitus have a tremendous impact on global health. While osteoporosis affects about 200 million people globally, estimates suggest that about 285 million people worldwide are affected with diabetes. Both diseases are detrimental to the bone, resulting in an increased risk for fragility fractures. There is plenty of evidence for prolonged exposure of diabetes to have a direct effect on impaired bone health, such as changes in the bone mineral density and bone structure, all of which would potentially result in increased risk of fragility fractures and delayed fracture healing. People with type 1 diabetes have a low bone mineral density, while people with type 2 diabetes have a higher bone mineral density. Irrespective of this difference, both populations are at an increased risk of fragility fractures. Bone mineral density measurement by dual energy X-ray absorptiometry or DEXA and assessment of clinical scores such as the WHO Fracture Risk Assessment Tool or FRAX are regarded as the international standards for assessment of fracture risk and are used in routine clinical practice. Despite the widespread availability of these measures, recent studies suggest that they underestimate true fracture risk, highlighting that the higher risk of fragility fractures in people with diabetes may be due to a mechanism that is not captured by routine clinical practice measures, and this underlines the need to identify novel biomarkers to accurately assess fracture risk in diabetes. In this regard, microRNAs are of particular interest to me. What are microRNAs? MicroRNAs are very tiny molecules present in our blood. They are referred to as the master maestros of the human genome. They are similar to performers at a music event and have the ability to orchestrate a large gene network to instrument normal body functioning. When microRNA expression is dysregulated, they lead to disease. In this case, dysregulation of microRNAs leads to an imbalance in bone formation and bone resorption, leading to fragility fractures. During my PhD, I am interested in identifying microRNAs as novel biomarkers for diabetes-induced bone fragility. These microRNAs have the ability to be designed as prognostic markers or as therapeutics and will help us address the increased fracture risk in people with diabetes.